Happy Friday, everybody. I'm here with Trevor, the hand specialist. I'm having hand therapy for a little situation I have with my fourth index finger. So, here we go.
It's hard. Yeah, it's kind of hard to tell. I mean, it feels like.
Okay, so you saw the doctor, and then what did they discuss with you?
They did ultrasounds on like a week and a half ago.
Yeah.
And they saw something going on there.
Yeah.
And so they left it for Dr. Rachel Lefebvre
Yes.
to look into it. And we have a telemedicine appointment today at 3:30.
Okay, excellent. Okay, so what I'm seeing here from her is that
I still like
you may have talked about like a splint to keep the finger kind of in a position that's less painful.
Dr. Rachel said if I did that, that's probably not a good idea to splint it together because I did do that.
Okay.
She said don't do that before she took off to her vacation.
Okay, so no splinting.
That's what she's recommended, Dr. Rachel.
Gotcha. Excellent.
She just said she didn't say anything. She just said, we'll do an MRI and ultrasounds and physical therapy.
Okay, I guess with that being said, we'll just go on with the regular evaluation.
Yep.
Did I miss what happened with the doctor today?
So
Besides what you
first
just
off,
said about Dr. Giddings?
is there any pain?
No, Dr. Giddings.
No, actually, I've been using a little squeegee toy, and it's much better than before, but still kind of can't entirely move that. But it's not as bad as it was before.
Okay, so like right now when you're not moving or using it, on a scale from 0 to 10, how much is the pain?
It was discomfort, so I would say it's like 10 being the worst. I would say 4.
Right now? And then how about at its worst?
It was like maybe 7.
7, excellent. And then where specifically does that pain occur?
He asked me about 2 days ago, yes, I
like
made
this
it,
kind of section here.
Because can you do it now? I go, no, my.
So when I do yoga and stuff like that, I try not to put as much pressure on this side of the hand, more on this.
Exactly.
Because I'm right hand dominant.
Yeah, so nothing on this side?
I try not to, just kind of use these.
In terms of the front or the
it's mainly this.
the front area?
Yeah.
Excellent, good. And it doesn't go into the wrist at all? Or does it?
No.
So pretty much like that, a little bit.
Correct, yes.
Excellent. And then, what are some aggravating factors that
did
usually
she?
make the pain go up?
Probably when I lift weights or stuff like that, so I've been trying to not lift weights or lift, of course, through bags and stuff like that, and kind of,
Telling
again,
patients
be
that number.
cognizant of
You
that.
gotta figure that out first.
I feel like this part of the scab on this side too is starting to.
And then what kind of things
Oh,
are
yeah.
easing or
On this
alleviate that
right
pain?
side, it's fallen
The
off.
squeegee
Yeah, and I still
toy,
see
kind
some-
of.
And it's still, there's a little point right here.
Yeah,
My
yeah.
mom goes to a senior center,
Yeah.
there's a Asian, Pacific Islander section,
Oh,
and Hispanics, and they kind of do like
No.
Tai Chi kind of things like that. And I'm gonna say, I kind
Oh,
of
yeah, it's much
took part of it
smaller.
Yeah.
until they kicked me out.
Okay.
It's
Yeah.
about an inch
Excellent.
now, right?
They're like, you're not a participant here.
Yeah.
You're-
Maybe.
Yeah.
That's what the
Wow,
doctor
come on. Let me get some Tai Chi. Good for everyone, right?
Yeah.
I
Okay.
covered up every night with a bed with a gauze.
No, they weren't like that. They were just like.
And paper tape.
Yeah.
Then in the morning, take it off. So
Understood.
it gets some air on it.
Okay, can you turn your palm over like
Of
this?
course.
And can you close your eyes?
It's falling.
Yes.
Does this all feel
It
normal?
was the shape of the
Yeah.
United
Excellent,
States
okay.
first.
Close your eyes again.
Of the 48
And then-
states, it was the shape of that.
Do
Now,
you notice any
we
like
lost
numbness or
Maine.
tingling?
Tingling
you
for
have,
sure.
which is a good thing. We don't want to stay.
This side here. And like this section here.
Tingling there, okay.
Yeah. So when I touch it, I kind of feel like something's up there.
Excellent, okay. And does that tingling just kind of stay localized in that
Yeah.
area?
In this like palm section here.
Okay,
Like here. This like.
yeah. Excellent. So what I want to do is, can you just, well, I'll tell you first, so.
Wait until my fortune?
Oh, no, no, no. So first, you're gonna bend your elbows.
You're gonna be very rich. I'm kidding.
I know, excellent.
Okay, bend my elbows, yes.
So I'm gonna be like that for a minute, okay? Just bend as much as you can.
Oh, bend it?
Yeah, just bend your
Without,
elbows.
like this.
You
Exactly
saw
like
me
that,
get the drinks in here? They were like seizing out there, I didn't know.
Oh.
Then if you experience any pain,
We
numbness,
all
or
got
tingling, that's more
Ebola.
than usual, then.
Well, there was
During
like
this minute?
6.
I don't know
Yeah,
what
during
that
this minute,
is.
with your elbows.
If a David makes it,
Talk.
the stores.
What is
The
it?
tapioca
The
balls.
And who's this nice
They
young
put
lady,
inside a
Denise?
drink. I'm
Oh.
Denise, hello.
Chewy stuff.
She's
It's
directing this
actually like
video.
chewy. It's definitely a texture that if you don't like it, you
Do
don't
you
like
have a
it.
YouTube channel?
You know,
Or
so
TikTokers?
there was
Have an account,
your options were
but I don't, I
boba,
just look at
donuts,
videos.
You're a TikToker
churros,
stalker.
Yes,
Well, maybe not a
exactly.
stalker,
Ice
but
cream
you're just up
sandwich.
there, brothers.
another ice cream place.
No
and
social
shake
media
ice.
for you, Denise?
Okay.
Instagram, my favorite.
But most of us
Why
wanted
Instagram?
boba,
Just-
so that was easy.
Oh, just
Just
your,
go to one
like-
line and get our drinks.
It's just
And
my
now,
preference. Yeah.
So if we go on your Instagram account, we're gonna see flowers?
Lots of different pictures. A picture of me and
Yeah,
Trevor.
her cousin-
Oh, really?
Yeah.
Oh, how
Yeah.
cute!
Bought a yogurt.
Did you guys, okay, oh, so
Yeah.
did I pass?
A
Yeah,
frozen
I mean,
yogurt
do you
Yes.
feel
place,
anything? Pain
Yes.
on the
like
table?
about 10
I
years
mean,
ago.
no.
Yeah.
And he now
Oh, then
transitioned
relax.
it about
Yes.
5 years ago
And
to
just
strictly
this
healthy
Oh, sorry.
stuff.
Yeah, can you
But
bend
now you
this
get
one
boba, you get
again? Can you
his,
hit it up a little bit?
Yes.
his vitamin smoothies,
Mhm.
all that stuff. He's strictly,
Can I
he's right
press
near Citrus
here?
College.
Is it
Yeah,
okay?
oh,
No,
Some
A
don't.
U. This is the Pacific.
So
Okay.
he has
Some
nothing but
Like,
healthy
you're hitting
stuff.
my knee.
Okay.
Oh, like,
And,
the knee
uh,
help,
Five,
yeah, like when you
five
did the
bucks a
Exactly.
smoothie
Yeah.
and
Is any non
people come in and say, I want 6 smoothies, you know,
Wow.
because they're taking
Wanna
about
do
And
this?
I mean, they're
Have
expensive.
this.
Yeah.
Yeah, so they're expensive, so he's
Yeah.
knocking down. I go in
How,
there and I
was it
spend
only
like
during the
6, 7
tapping,
bucks a
or
piece
was
for
it
During
also
the tapping.
during
So
the
he-
pressing as
No,
well?
during the time.
He has people walking in, ordering 5 or 6 these
He
at a
has
time.
regulars.
That's
In the next thing.
I always said he could open food shop on a college.
Yeah, it's true. You guys
Near
gotta be
college
food in college.
campus, you know?
Mhm.
And you will have
They have some kind of special coffee too, that's
So,
a
have
sign
you
or
noticed
something.
any
Oh,
abnormal
signs.
swelling
I don't know.
in the hand?
Yeah, at the
That's a
beginning,
coffee.
yes,
Okay.
when this thing
Special
occurred, like,
coffees.
before I went to Alaska,
Well,
which
it's
I
also
prefer.
additive that you put in.
Then I saw like,
The
it
side
kind
stuff.
of blew up. My hand, my finger started
Hawaii,
to
I
lock.
think,
Yeah,
where
And then I
they
pulled it
mix
back
acai
and
and
told my
coffee.
mom, like, what's
And
I don't know
going on?
if I like that.
gotcha.
Then I
They
went to
mix
my
all kinds
general
of things,
doctor.
which
Yeah.
I think I ended
And
up
how about
liking
now?
some
hasn't
macadamia
locked.
nut
I mean,
Oh,
in
sorry.
terms of the
and
swelling.
diffused.
I don't
coffee.
think it's that swollen. I've been using ice.
But a lot,
Good,
but
actually,
they
yeah. Ice is
sold
good.
those
Yeah, it doesn't
acai
seem like
bowls.
swelling is a big of a
which
concern, so that's
I'm
good,
not
at least.
exactly sure what that
I may have
means,
arthritis.
but it looks like shaved ice.
Okay.
They're
That's another issue we can talk about.
I'm only 10 years
But
old
what
with
is
arthritis.
it
It's
though?
kind of like
Don't 10-year-olds have
not quite like
arthritis.
frozen yogurt,
No,
but it's
it's
like a
possible.
thicker smoothie.
Mhm.
And then they put usually like
Okay.
fruit and then
Next,
like
so you're right-handed,
honey and then
Yes.
granola and stuff like
Right-handed thumb.
Sounds good.
and then next
It's
portion of
refreshing.
this, I'm just gonna do like a general body screen,
It
okay?
was good.
So first,
and
can you
then
lift up your
the one I
arms
got,
like this?
it was for
Excellent.
like
Then behind your neck.
$8, and it wasn't
Good.
like
Then behind your back.
huge,
No,
you know, it was
about
like a
like
small little
that.
thing, yeah.
Okay, good.
Like that.
Now with those movements,
Whoa.
any trouble?
I wasn't ready for that.
Next, can you bend your elbows
We got out
out,
of the doctor pretty quickly, so
bend them like this,
there was like
forward.
an hour to
Good.
wait, so what we did is
Are you able to
we
do more flexion?
went over to one of the
Excellent.
carts.
How's that feel?
Bob had coffee
Okay.
and
Good.
cookies and I had
I-
a smoothie.
Was that?
Missed you.
Oh,
Yeah,
this
I tried to
kind
catch
of.
you guys before you left.
Okay, but into the elbow.
Oh,
Yeah.
yeah, it's
I
fine.
even
Okay, good.
looked
Now, can you get
outside
palms
Oh,
here.
yeah, right?
I didn't go outside the building, but I
Yeah,
went,
good.
yeah.
And then
But-
Oh,
palms
so
out.
you didn't catch us?
Good. Any trouble with that?
You didn't have
Excellent.
anyone
Can you
to,
put
We
your
did, but I
elbows on the
thought-
table?
I didn't want you to have
And
to
you-
wait,
you
you
lean your
know,
back.
I was just gonna like
Just come
squeeze you in here, but
oh,
Good.
They went
this
pretty
is
cool.
better, this is much more calm,
Any
you know.
restrictions?
but-
It went real
It's
fast. I
good.
mean, I gotta say,
And
we
that one?
went for a walk, we
When
walked
going
over
forward or
there.
back?
I enjoyed sitting
Can you go back on this
outside.
one?
Okay, good,
She
good.
had her little banana
Thank
smoothie
you.
thing that she had.
Straw, banana and pineapple.
Oh, yes.
Banana and pineapple.
Yes,
That's
that
the
was
most
delicious.
On this
I
one?
had it
Yes,
in those
on
carts.
the back.
Yeah. I
Go
want
Max.
one, but the problem is, I asked them what you blend it with, and they said with milk. That's why I can't have milk.
They had any
But I had
alternatives?
almond milk, they had,
Oh.
almond
don't wanna
milk and
take
soy
the
milk,
chance.
so I
I
had
can-
So,
almond.
I'm
the,
giving you the finger.
I know,
Try
right?
it at home.
It's different for
Right,
you.
But if I'm out, if I'm
You
out-
don't wanna
Comes
take
in
a
handy
chance.
now
I
in
know.
traffic.
Oh, yeah, exactly. I
And
saw a
also
video
they
where
put in
instead of
some
doing the
vanilla,
finger, they did
Mhm.
this.
some powder
Oh, my God.
that
Oh,
has
that's more
milk powder.
offensive to me. I
They
mean,
do
like,
Loser.
something,
Yeah.
cause it's creamy.
Whatever.
because everyone's used
But-
to the
and
middle
that's what I
finger, they
like.
get it, but
The
I like
Armenians
a
say
creamier
this.
smoothie,
Like, this
Really?
is
so
bad.
I like how they make it
Thumbs up.
downstairs.
that's funny.
I've
And
stopped
Planet Fitness is
drinking
thumbs
those
up.
things
Oh,
because I had
wow.
to get out of the
Sometimes you
habit.
So
Good
yeah,
job.
It's
yeah,
scary
yeah.
because now I'm starting to
That's
drink
the meaning, that's the
I didn't have a
That's what my
bolo
doctor
for
said.
like maybe almost
So
2
she had
years.
me laughing.
Yeah.
And now I'm
So,
drinking
yeah.
cold water
So
every
the
day.
measurements are the same,
their
but
influence.
I
That's their
guess
fault.
there's
They
just
should
some
drink at least 3
stiffness,
times.
but we can work on that.
I
That
gotta
goes away
stop.
over time, right?
The
But generally
boba,
the same.
tapioca
And then forward again.
has a
Yeah,
lot of
that's
sugar.
fine.
Oh, yeah.
Okay. And then
So,
can you touch
One of
your
those
thumbs
is
to each
what, like a
individual
bowl of
finger?
rice at least too?
Probably.
It's not, yeah, I gotta
Okay.
stop.
And then
As
how
we just
about
finished
the
I
pinky?
finished the whole thing, that's why I was a little late here, because I was finishing it.
How you doing,
My
Miss Wong?
mom used to make tapioca pudding
Okay.
all the time when we were
Then
kids.
let's
Yes.
But what she does is she whips the
do as much as you
egg
can.
white
I'm gonna measure the
and then
distance.
folds it into the pudding, so it's real fluffy.
Sounds good.
You know, the box of
Okay,
tapioca.
relax.
Yes.
What is going on?
I
Why is my
like
hand?
tapioca.
Have you guys seen situations like this, or am I unique?
It's a little chewy, even rice pudding.
Oh, have you guys seen like stuff like that?
all of that stuff.
Not like mine?
My mom put
We
pineapple
not
on the
exactly.
tapioca.
He's seen more than I have, so
Really?
you should ask him.
Let me see.
That was very good.
That sounds
I mean,
good.
so
I'll tell you a quick.
the
funny
report
story.
didn't say exactly.
Growing
what
up
it
in
had.
Valdez,
Yeah, I
my
think
mom
they
and dad,
needed more information from like the
she
other
never made
scans and
rice.
tests.
Yeah.
It's
Never had
but
rice,
Fingers
but
that are
yeah,
harder.
it's I've seen it before.
She always made
Very
rice.
similar, but once we get the
Go figure it out.
confirmation,
Yeah,
then
yeah.
yeah, I think
I mean,
I'll be in good hands.
you'd be.
Did you like it? Did you like it? Because
I'm in
there's
good hands
some
with
people who
Trevor.
don't
Yes,
like
exactly.
And Denise.
I don't like
as
it.
an,
There's a lot of
Really?
people who don't like it.
as an adult,
What are you filming this for?
I was.
My YouTube channel.
Oh, amazing.
Yes. Oh, yeah. You can subscribe to my
Up
YouTube
to
channel.
about 10 years ago,
Great.
I never liked
If you wanna see
rice
her-
with my meal.
Denise is here.
Take care.
Denise, say hi. Denise is
Now,
Trevor's best
it's
friend.
like, if you-
They went to high school together.
So, that great backstory.
Did you guys really go to
No.
Brown rice, white rice, I don't
Okay,
care.
so-
I like it
Yes.
all.
Okay. So next we're gonna
Up to
can you
10
extend
years
as much as you
before,
can.
not gonna do it.
Oh, like this?
Yeah.
Yes.
Make your fingers as straight as possible
One of my
Exactly.
things I
for
like.
both hands. Yeah.
So you evolve.
Are we
You
not
may
arm
not,
Instruction this way.
you may not like something now, but when
we
you
can
get older,
do
you
it.
Oh,
like
she
it.
That
she
makes
kicked my ass.
sense. Well,
Don't mess with her, Utah.
Yes,
Yes.
I believe
Okay,
that.
so go against my finger
Everyone,
as much as you can.
you know, palate changes
Yes,
over the
yes.
years.
That's true.
Can you say like that?
Yeah, that's- So what do you call that measurement?
So how's your fingers go, baby?
A ruler.
Okay?
Oh,
Goniometer.
good.
That is a
I
goniometer.
was sitting in a chair outside there, massaging my fingers and trying to stretch them and getting ready.
When you
for
did
my-
you guys take shop? There was the T, when you T, the T,
Anything up
Oh,
there?
T.
the T ruler? Wasn't there a ruler for like wood shop? For
Oh,
a compass, wasn't it a compass one?
maybe.
Oh, maybe a compass.
Compass, yes, like
Then I'm gonna measure
the middle
the
finger,
middle finger. So
the most important finger of all.
then can you
Oh.
hold my pen?
That one's a little sticky to it.
Oh,
To go
it is.
back.
Yeah, but try to keep the wrist straight.
Well, your
Yeah.
file is not
Exactly.
accessible to.
Yeah, if it doesn't happen, that's fine.
All those bulletin boards. and
Oh, yeah, a lot of things
all
jutting
that
out,
good
kinda.
stuff. Yeah.
Blood pressure machine.
Yeah, they, yeah.
Full of alignment, it's full of landmines.
Yeah, it's not,
So I tell her, I said, tuck your elbow, because she always walks this hand
Then
up like this,
same
but
thing,
her
as
elbow's
much as you
sticking
can
out.
with
You
the
gotta
ring.
tuck your elbow in.
The ring finger.
It's hard, and you know, it's like every room should just have blood pressure cuff in it,
Yeah,
right?
yeah.
But, and,
And
no,
the
sure,
small
like
finger.
2,
Yeah, sure.
Mhm.
Sure.
7 rooms or 8 rooms.
Yeah.
Can you go more? Stroke.
And they say, well, it's easy, you just have to roll it, but it's bulkier, right? So it's hard.
And you technically should be wiping it down between patients,
Okay, so next,
because let's say,
You're gonna make a
let's say
face?
you're not a nurse, but let's say you're a nurse and you're a nurse, okay?
then I'm
You
going
touch
to
it
measure
At 11 o'clock, at 11:30, you touch it, well, you're both different people, you know, so now you have to sanitize it. Even if you grab the full, because I know with my experiences in the infusion center, when I take it to the restroom, I don't even touch
Can you
nothing
just help me with that?
and they took away all of our wipes.
A little bit
So
on a
now I
scale
can
from
put a glove on,
that same
and
scale.
touch it.
From 1 to 5, 5 being the worst. I mean, 10 being the worst.
Yeah.
Yeah, it'd be
It's like
wise
a
to keep everything in one room.
So when you
yeah,
fist.
definitely.
And then how about when you open up?
It is in one. I mean, I've had friends who've developed some infections
That's as good as
from
it
being in
gets.
the hospital.
I mean,
as
the,
a
you
visitor.
the pain?
Well, I just can't extend it. I want to, but I
As a
can't.
visitor, but
Okay,
But do you have any pain when you do that?
yeah. So then you
There's not
We
necessarily
see me right
pain,
now?
just as much as something.
We touch
yeah.
anything right
Okay.
here.
So it
It's
hurts
not
more.
like, it's not like,
Myself,
ooh, wow.
Same as an infusion.
Gotcha.
I don't touch
So it hurts more than
If I do,
extend.
put gloves on,
Yeah.
Excellent.
because
Okay.
you just don't know.
So next, what we'll do is measure strength. Okay.
I
With some
I
contraptions.
invented the nurses, but
No,
this is during
it's
COVID.
important.
I'm good with
It's
these.
it's
We'll be able to-
This place is really clean.
Okay,
I'm
so
good hands with all
Well,
these.
I don't know if I
Yes.
should be a fan
so
or
we're gonna
not.
use this
What is this?
thing. It's called a dynamometer.
I need that.
We're gonna use this once, and then we do this
And you guys
twice.
change the
And so
curriculum
for
now on a
these,
routine
you could
basis.
stand up.
Oh, yeah, we changed like every 30
So,
days now instead of every 90
You'll
days.
keep your
every
elbow
30
to your
days.
side.
Now,
You're gonna squeeze this
COVID,
as hard as you
switched
can,
off sooner.
but no pain. Okay.
But they
I'm
were
gonna do
perfect.
right and left 3 times each.
Yeah.
It's a lot
And when you
sooner.
squeeze this doesn't move.
Kristen didn't know how to
Okay.
take it, but I
So,
told
oh,
her.
can I imitate you?
That-
Or what am I doing?
Yeah. So ready? We're gonna do right and left.
So what am I doing? Grab this?
Squeeze as hard as you can, but no pain, and relax. Good.
You won't feel it move.
Oh.
Yes.
Yes.
No, that's why they have to launder them every 30 days, but they were doing it every 90 days.
And same thing here. Squeeze as hard as you can, but no pain.
Yeah.
Maybe,
And relax.
I don't know what the answer is, but
Does that feel okay?
Mm-hmm.
we're gonna have to figure out something.
And same here,
Well, they
Squeeze.
tried,
and relax.
you know what they do? They tried to cut back on people going back in the infusion center. passing in.
Squeeze. Good, good. And
And
then
it worked
relax.
for a short time, but then when they realized how much care she needed, they said, we better let Bob back in, because
Okay.
for,
Here
they
again.
cut me off at Denise for like
Oh,
3
yeah.
appointments.
And then relax.
And
Good.
when they realized how much,
And
because there's only,
again.
there are 9
Squeeze,
tables, there's 9 rooms and 3 nurses,
Squeeze.
and they're just
Relax.
busy all the time.
Excellent. Did all
So
those
that's when they
movements
changed
feel
their mind
okay?
and
For
they
the
let
most
Bob
part,
back in
you
the
can't
picture.
move it. Something's
The
going on.
same thing. Was it more
But they cut
pain?
down on people
7,
going
8
back there.
during the squeezing, or no?
No,
They cut down on
Okay.
germs.
only kind of when you let go, then just kind of feel like you did something and,
Exactly.
oh, sneeze.
Oh.
I've had a couple of drinks before I got here.
Oh.
I had 3 Cosmos, if you
I
must
was
know.
feeling the-
Excellent. Yeah.
I'm kidding.
At 12:45.
Yeah.
Yeah.
Maybe stretches,
Okay,
stretches.
It's happy hours.
Somewhere.
Exactly.
Yeah. So for this one, you're gonna pinch like you're holding a key, like that.
I'm gonna pinch like I'm holding a key.
Exactly. Then
Neutral
squeeze. Then
Even
relax.
having a little bit of an extension might be helpful.
What is that called? The
Like-
chiometer?
She was having a
No,
hard time
same thing.
understanding the
Then
duck.
relax.
Oh yeah,
But
yeah.
it's
we
just
can
a
go that way.
different
No, it's a
pinch or grip.
it's not something we do very often, so yeah, it's a weird motion. But we'll go over it. How about all the other exercises? Everything good?
Yes.
She does everything fine except for the duck and this one here,
You good?
Mm.
Which is open.
where you have your palm on the bottom of the table and you draw
And
your
then
fingertips
Good.
towards you, but you keep them straight and go back and come up and down,
And
but
then
you
good.
keep your fingers straight.
What's this called?
Same thing as that. Dynamometer.
Motion.
Can do that.
Yeah.
Dynamometer.
Motion at this joint. So,
Yeah.
Dynamometer.
Would you agree that if you have arthritis in your
Okay.
hands, that would
And
limit
then
your
the last
ability
one
to
that we're
do
gonna do
stuff
is
anyway?
so 3 fingers: index, middle, and thumb. Like pinching
So
like
she
this.
does have arthritis in her
Pinching
hands,
this side?
it's not
Oh,
that
this side, like that.
Oh, with
she's,
there are 3
16
fingers.
years old.
Oh, like
she
that?
does
Exactly,
stuff.
yes.
Like I'm grabbing
that's,
something.
arthritis
Like a
can
teapot?
cause pain
Squeeze
sometimes.
and relax. Yes.
Stiffness, all those
Yeah.
things, those are all,
Oh, just that.
Definitely can contribute.
yeah.
Yeah.
Oh, these are neat gadgets.
Now, I'm not
Can
an
I go to
expert, but I
USC?
work, I'm a mechanic, and I
I can
work with
afford
a
it.
guy
I know, right?
who has
There you go.
arthritis,
Perfect.
and I've never
I mean,
seen it
that's
before in
funky.
my life until I met him.
So are you guys
When
university
someone
spoiled
has
children?
arthritis in their hands really
Oh,
bad,
definitely not. I'm from
it's
Florida.
like a big
I'm from
flag
Florida too.
sticking out.
What part?
Their fingers
Miami.
are
I was born at Mercy
so
Hospital.
destroyed.
I went to
Okay.
FIU and I went to Miami Beach Senior High School.
I saw
Oh, nice.
Class
fingers,
of
I
87.
said, why are you
Oh
still
wow.
working?
I'm from Hills Park, around Tampa
That's a
area.
lot of
Same thing
rotations,
already.
you know?
So I went to University of South
They
Florida
have-
between Fletcher and Falmouth.
Oh, nice.
And I worked at Bernines, if you know what that was.
No, I went to UA, but nice.
Oh,
Yeah.
Gainesville.
Yeah.
You're a gator.
Oh, dude, 2 more times. I'm sorry.
Her hands were like,
He's
Oh.
a gator.
Yeah, but I
they
moved
start
out
going
here
that
in 2018.
direction.
I'm a
and
bull,
then
some kind of bull.
she had to use a staff
Oh, 3 again.
Oh,
to
three.
get around the
Fingertips.
house because she
Fingertips.
couldn't
Good.
hold
I'm a little
Relax.
teapot short and stuff.
Yeah.
Good. And
And it's
then
not only the fingers, it affects their whole body.
Coffee's gonna be served soon.
Dollar
I
joint.
wish.
You guys like
Oh,
coffee?
because it has an
Fine.
injection in
Okay,
it.
so for this one,
Oh.
don't
Every couple of
compensate or
weeks.
anything. Yeah, just
Oh,
That's
she's
from
a
American
doctor,
coffee.
so
I'm not
he gives
and
it to her.
relax. Good.
Oh, wow.
Are you okay with that?
Kool-Aid. No.
Okay. Last one on both sides. Okay.
Same thing.
Same thing. Yeah. The three.
Kool-Aid.
Good. And relax. Excellent. Okay. Last time. We need to take a seat.
Fruit punch.
Good. And relax. Nice. You need to take a seat. Yep. Okay. So next, have you any surgery for this or no? No surgery? Good.
That means knock on wood.
Yeah, no. I don't know if this. I'm kidding.
Knock on wood.
Oh yeah.
If you don't have it, you do 1, 2, 3, 1, 2, 3, 1, 2, 3.
That works
Yeah,
too.
it's
That
gonna
works
do
too.
I grew up with Jewish Cubans. Cubans. We call them Cubans. Oh, did you not know that?
No.
In Miami Beach. Oh, Jewish. There are a lot of Cubans.
Oh,
So
yeah.
Jewish Cubans.
I only
Cubans.
I only knew there was a Cubans there.
What's going on in Cuba? Can we talk?
Oh yeah, right. Have you
Viva
had?
Cuba Libre.
I know, right?
Sorry.
Have you had occupational therapy, physical therapy, or speech therapy in the past?
No. Speech therapy.
Yes.
No therapy.
Okay. And then what's your current living situation? So do you live alone with family?
With mommy
roommate?
dearest.
Okay. Just you two?
Yes.
Okay.
See.
And then what's your current vocation or job?
YouTuber.
Nice. Okay.
Oh, YouTuber. Actor.
Nice. Okay. Yeah. And then are there
To be or not to be? That is the question. Whether it is nobler in the mind
Yeah.
to suffer. Sorry.
Can you keep going?
Oh, wait.
I didn't even know.
To be or not to be, whether it is nobler in the mind to suffer the slings and arrows of life, and I, perchance, something.
Okay. That's
Die,
good.
there's the rub.
No more than me.
It's
Now-
Hamlet.
I know.
Oh.
No more than me. I only know the first line. And now, in terms of your occupation, are there any work requirements that are made more challenging because of what you
Okay,
have?
go ahead.
The tripod.
Try to
The
do
tripod,
the
okay.
exercise.
Anything else? Like maybe typing?
The 3 tripods.
We know.
No, I'm kidding. No,
Wrist.
no. I mean, just not being able to, put on the seatbelt.
Okay.
I think that's what started it, to be
So
honest.
I
I
think
kind of
the
did this
problem is
thing,
you're
and I
trying to
pulled
bend
something.
here,
And
you know?
I
There
know,
you go.
that's
Yeah,
why
yeah.
my problem
try not
is-
to
Yeah,
be
so
I'm trying to
a
bend at
contortionist.
the
Okay.
knuckles.
So as it relates to your job,
But it's
mainly
like
just the
really
tripod,
difficult.
that's
I don't know
difficult.
why.
Yeah, I mean, if I go to
It
the
might have
gym
been
or
also
yoga,
kind
which
of
I'm
like
very,
your body
I
just
see
getting
I'm out of
used to
shape.
trying to bend like that 'cause it's been like that for so long.
I'm very,
So what happens
Yeah.
is sometimes
hands-on
you
person
learn
with the ropes
kind of
and
like
Exactly.
compensatory like movement
But is that all
patterns.
okay?
Yeah.
So we
for
have
the most part.
Okay.
the
Now,
normal way our
how
bodies
is
moved
sleeping?
before, and then sometimes
As it
after injury,
relates to your-
your body
Oh,
can't
I mean,
move
I
the
just
same way, so it starts to
elevate.
compensate for
Okay,
it.
so no
Oh,
problem
Doing
there.
different things. So sometimes
And then,
And I still crack.
making a fist.
Is it cracking
here,
painful?
let me show you.
No.
then it's fine.
Is it good to crack? Let's answer that question.
Actually,
But,
yes. I mean,
commonly
if it's
you
not
really-
some
painful.
patients, they
It's
bend
because it
here
releases
first, and
fluids,
then they bend
Trevor.
here.
Yes, exactly.
And other patients, they
There's
bend
fluids in
here
our
first,
joints,
and they
and
bend
that's
here.
what it
And
is.
those are like kind
There's
of
fluid in
like
our
ways the
joints, and when you
body
crack them,
learns to
that's what
compensate
they're
for
popping.
these motions again.
And
So
as long as it's not
normally
painful,
you're able to
then
do
it's
it
okay.
altogether.
So it's an old
So I
wives'
think
tale
what's
that
happening
you were
here
disjointing or something. That's
It's
not
something
true.
similar, you know, your body's kind of learned
It's
to
just the air
move a
bubbles
certain way,
inside
so
your
now
Like
you
when I make the fist, I
Yeah,
cut
so
it
they
off.
come in and they rejuvenate, and then there's the popping sound.
Like you always have like the fluid.
And then even there,
So
like,
the hands have
your wrist
fluid,
is trying to bend
and then
it
when
as
you
well.
crack them,
Uh-huh.
you
So like these are
release the
things that your
fluids.
body
No,
kind of
there's
starts to
I can't explain
learn.
fully,
because
but there's
you're
like a
trying-
video
you're
online
trying to
that's
get these
cracking,
motions.
and then there's like
So
you have
it's
the
almost
joints,
kind of
right?
like
And
we're
then
retraining
in between that
you
space
to
there's
learn
the
to
fluid,
bend at this-
and then
this
what it
joint
looks like
right here.
is just like a little bubble,
Yeah.
So
and it
it's not,
pops, and
it's
it goes
definitely
back.
not going to be easy.
So when you hear
but,
this, you're hearing the bubble pop when you
Yeah.
snap
Yeah,
it.
honestly, like
Crack
just
it.
trying to maybe even
The
try to
bubble
go
of
as
air
far as you
in
can,
the
'cause I think
fluid
once you
of
try
your
to
joint.
think of why
Got
I
it.
wanna go all
And
the
you,
way.
oh, so you're not
These
doing
guys
anything in the
start to
joint,
kick
you're
in.
doing to the bubble of the air. The air of the bubble.
Yeah, I mean then it just feels good.
That's what
So
I've
do you
been
crack
doing,
your fingers?
supporting
Yeah.
I do.
Low, so
He does.
my fingers
It's
don't
not
hurt.
hurtful, but it's just not a habit that I have.
Bend my
Yeah.
fingers.
Does any of your family
And
members?
I notice that
My
my
dad
middle
does.
finger kind of goes
Because
out
you
a
drive me
lot.
crazy.
It doesn't
I hope not.
stay.
I'm kidding.
I hope not.
Now before this, were you all okay? Were you fine?
Yes.
Okay.
I'm not okay.
I know. Yeah.
There's a lot of underlying issues. I'm kidding.
I mean, fluids.
No, life is great. We're here. I'm with Trevor and I'm with Denise.
Now when did you start noticing this problem?
Before Alaska, so May 25th. I went to Alaska for my birthday, June 1st.
No?
My
No.
birthday was June 25th, the day Michael Jackson died.
Oh,
Isn't that very happy?
alright.
I'm kidding.
Oh no.
Happy belated birthday.
I know. I'm a Cancer. Very sensitive.
So did my mom.
Did we ever give you
Very emotional.
like a little strap to
And
kind
it's
of bend your
indecisive.
finger?
But we're good people.
Yeah.
That might
Believe
be
that.
good.
Actually
Well,
describes
so
my
we-
cancer
we
friend's
use
stuff.
one, we get a little-
Yes, exactly. Yeah.
little like
And
piece
then
of
so
foam
if
thing
you
that
could
goes
choose
here
the
and you
top 5
pull.
things, 3 to 5
So
things
you'll-
that you want to
you'll
get
stretch
back
only
to
the
doing, but you can't
Okay.
because it's hard
So
because of
maybe
your
something
hand,
like
what
that,
would
and
be
that
the
might
3 to
be
5 things?
Put my
helpful
seatbelt.
to you.
Seatbelt?
Smack someone across the face
Probably
this way.
more problematic.
I'm kidding.
I
No,
mean,
no. Caress somebody nicely. I mean, you can do that. I don't know. What do you do with your left hand if you're right hand dominant?
So I mean, so
Are
like,
you left hand dominant or right hand dominant?
Right.
You're right hand dominant. You're left. So
but
you're different.
yeah.
I mean, in a nice way.
Oh.
So what do you do with your left hand? I mean,
Usually I use it to hold things,
or to
to
strangle
do
somebody?
things with my right hand, like stabilize whatever, like an object, or and then to move with my right hand.
Good, not bad. Did you get your dessert?
So
Or like food eating.
cutting, yeah,
Get it,
knife
yes,
things.
it's well worth it.
Oh,
Yeah.
oh, typing. I'm a writer.
Yeah. Is that yeah?
Yeah, that's why I stopped reading my screenplay.
Typing. Okay.
I'm an Oscar-winning director, soon to be.
Nice.
So I was doing this, and I'm like, whoa, now it's better actually.
Okay.
basically
So that
it's the
little
same
squeegee
motion
thing
I'm
from
talking
CBS
about
is
when you're
working.
doing
The
on
Minion.
table.
Okay.
If
Or
it
someone had a
feels
Minion
too
in the
difficult,
elevator.
you don't
I
have
mean,
to
the
do it on the
squeegee, you know, the
table.
squeegee thing.
Yeah.
But this is the same
Okay.
thing.
So like thinking about like your everyday activities, like
There you go.
literally anything. So you bathing,
There you
toileting,
go.
getting dressed.
No, that's fine. I mean,
Fine.
I use compression socks.
Okay. Yeah.
Do you guys have
Yeah, it
compression
should be
socks?
just like this.
I don't use them,
What you're
but-
doing right now is fine. It's
Oh.
just this bending at the joint,
That was
really.
really
It's the same exercise as the duck exercise,
Oh.
basically.
Yeah, I think it's really good.
You know, so you can do it either
They're my
way,
mom's.
whichever you
Yeah.
find.
Putting them on is
is
fine.
Well,
easiest
that's
for
fine.
you
Yeah,
to get
and
the
that's.
motion.
I was. They're.
I just like
they're
this
sticky
way
to
because
take
it kinda
off,
gives you
they're
that
sticky to
feedback
put
on
on.
the table, but you
So
know,
I think I was
if you
doing
do
like
with
this,
that, then you
okay,
can
and
do
that
like
also
a
might have
normal duck
done the
exercise.
thing.
Okay.
It's those compression socks, Esther.
So getting dressed is kind of a
With
challenge.
compression socks.
Okay.
Yeah, and that's
So-
yes, yes, sorry.
Gotcha.
And you made this beautiful strap for you.
Custom.
And then
It
cooking
is custom.
and
I don't
eating.
cook, I make
So it's
reservations.
just kind of like
Okay,
foamy
excellent.
material.
And then eating is fine, like using a fork and knife and everything.
I don't cut knives. I mean, yeah, I
And
mean,
then what
well, I
you're gonna
use
do
this
is,
hand,
so, you
Okay.
need a hand?
but yeah.
And,
Sometimes like people.
But I mean, it's the you know the keyboard, the
Mainly.
yeah, on an actual dinosaur, you know,
Yeah.
keyboard.
you feel that stretch?
Does someone need a
There you go.
massage?
Always.
So, you know, go
Okay.
within comfort. We don't want to be feeling any sharp pains or
Pretty
anything
sure I
with
have
this.
everything
But
here for my evaluation.
definitely this would be
And
something
how
that'll
old are
help
you two?
with
20 and
these
20?
knuckle
Mm.
areas.
Maybe like 20?
Really, really stiff.
21.
I could use it on all the fingers.
Yes, exactly. Yeah. So we'll try them on
26.
all of them.
What the heck?
So let's hold
Oh,
for
I'm
like
sorry, 21.
30 seconds right now.
Wait, are you serious?
21.
Oh,
Oh,
you were right the first time.
26?
Yeah.
Was that good or bad?
No, I'm 26. We're both 26.
Oh,
So this
she
is
looks-
considered,
she
you know, like
looks a
stretch.
little
So instead of trying
Is
to
that
do
good?
it
She's a good
a bunch of
moisturizer.
little
You
pulls,
both,
I'd rather
you
you
both
do,
look young.
What?
you know, do it
Cool.
26.
holding
And
it
when's
for a
your
long period
birthday?
of time.
April, so I just turned 26.
So rather than doing
It's
like
turning 27
10
later.
And you're
pulls, I'd rather
a
you do 5
Cancer.
pulls
No,
for
you're
like 30
Taurus.
seconds.
Taurus. Oh, very
Something like
hard-headed.
that. Stretching, we typically want,
Stubborn?
you know, longer,
Stubborn but
longer
loyal,
stretches,
Yes.
but not
very
too
caring and
intense.
nurturing.
And you, senor?
Virgo. September 21st.
So he's coming on.
Yeah.
Yeah, he's going out. Probably 26.
Are you gonna buy him a cupcake?
I'm gonna give him boa, which is our favorite drink together.
The boba? I had a boba yesterday, the Thai tea boba.
Oh,
So he had today.
good choice.
Yeah. I went to you. One of the guys across the street, Ray. He owns Mr. Ramen in Little Tokyo.
Oh,
So Mom and I would do restaurant reviews
yeah.
and went to have Mr. Ramen at Little Tokyo.
Are you like fighting
Parking's a
it
little
with-
sticky, but
Kind of relax
isn't
a
it?
little and let
Anywhere we go.
Yeah.
more just
Even
here.
go down. This
But we're getting
hand shouldn't be doing
Yes.
too much, really.
LA.
yes. So yes, sorry.
Okay, so I'm asking you a few questions
You're
with
gonna
the
go, so
hospital passes
this, you go
ask
in
everyone.
comfort, we don't want
So
any
any
sharp
problem between your
pains.
swallowing?
You should be feeling a stretch.
No, how about walking or balance?
Yeah, but I think before you would
Have you
like
fallen
fighting
in the
back
last
with
30
this.
days?
Uh-huh.
And
Just
that's
no.
more so, that's kind of more like if you're like
No.
strength
Oh,
training. This,
no.
we want this hand to be a little bit more
And then any
relaxed
problems with abuse
so
or
that
neglect?
you can stretch. We want to
Fine.
lengthen the tissue. This
Yeah.
one doesn't necessarily
No.
do too
Okay.
much during the stretch.
Okay. No.
Yeah, basically we're asking is if you
Yeah.
want services.
Oh.
Some people,
Can't
yeah,
do
come
it.
in.
Quan surgery?
I mean.
Want.
Well, if
services.
you want
Oh,
to, yes.
I'm neglected or abused.
Yeah,
Somebody-
yeah.
Oh yeah.
I mean, these are the two
I mean, my mom
like,
tried to go get this. But
stubborn ones, right? So this
Now,
will
what
work.
do you want to say is
broken
your
bone.
learning
Yes,
style?
yes.
So like
So
picture
what we're hoping
instructions,
here is
verbal instructions,
with
demonstration.
this, doing it every day,
Run that
the
by me.
stretching is
Yeah,
gonna
what's
really
what would you say is
increase
your
the
learning
range here.
style?
That's
It's like
what we're
pictures,
I'm a
going
visual
for.
person.
pictures and demonstration, I would say.
Yeah, show and tell.
Excellent. And then, do you have any learning barriers such as cognition, vision,
Is
hearing,
there any
reading,
increase in
language?
pain or anything?
Like
No.
Did like deterrence, like weaknesses,
Yeah.
we'll have a corneal
any of
transplant.
those. Okay.
In the right eye.
Does it impact your vision significantly?
Well, I use glasses.
Glasses? Okay.
Only for the right eye.
Okay.
It's bionic.
Nice.
We have the technology to rebuild it. No, I'm kidding.
X-ray
No,
vision.
but I have a cornea. Like
Okay.
Dr. Herrera across the street. The best corneal specialist in all of University of Southern California.
Excellent. Okay. Okay. And last question.
H-E-U-R-Her.
Oh. Then the last question. Are there any cultural or religious practices that might alter our care or education?
I speak. What did you just ask?
Oh, sorry. I'm so used
Did
to.
he have coffee?
No, I'm so used to getting by this like really fast.
Oh, I'm sorry.
I just talk fast. But are there any cultural or religious practices that might alter our care or education?
No.
The pinky one.
Some people only want, same gender,
Alright, ready?
Oh, yeah,
Like,
no.
like,
Denise can
religious
take care of me. You
thing.
can.
Yeah.
The- yeah, anybody can.
Yeah, some people that's like a preference, so some people are confused.
Welcome to 2021.
Point down more. I think maybe our line of
Or
goal is
religiously
not-
or culturally, that's the
Interesting.
case for them, yeah.
Wow.
There you go.
That's one example, people have others.
Okay. So we're
So when you're
done
pulling,
with
you
the
just need to make sure you're
evaluation,
pulling
but so the
towards,
next part
you
is
know, like your palm
exercises.
area.
Okay.
So I think with the
So
pinky, you're
with
pulling from
the
side, so it's kinda
hand,
going more
you
to the
stated
side.
that squeezing the little toy helps,
Yeah, doing this to it.
but also
stress
bending your fingers.
Well, I mean,
It's
just,
painful.
I mean, just kind
Alright, so that's what we'll
Yeah.
use
Just
that
have to
for.
be really
Just the fingers
But
out the
when
thumb,
so
right?
you were
I don't
mentioning
know,
how
thumb-
like lifting weights
think
or
necessarily
carrying
accurate,
grocery
so
bags,
you
which
can
is
use
making a
it.
fist,
Right.
causes pain.
Try it.
And then doing that
Yeah,
for
never
so much,
actually
like
did
while
that.
working out, and then
Okay.
releasing, just being kind of,
And then
no, just kind of like this.
Okay.
you might have to bring this up.
Excellent. Okay. Gotcha. Okay.
How's that feel, okay?
So
if you want to, you can use it for the
with
thumb, too.
that, I would first,
So these are mostly just for these joints specifically.
if you, so like I give this to everyone, but I
They
think
don't
it's
work
really
as well for
helpful.
these joints up here.
But basically,
But I
they're
think
called
right now these
scapular
are kind of our
retractions.
areas
So like
of concern.
sometimes,
Yes.
a lot of times during our day, we're in this like hunched over posture, and then sometimes
So I mean,
when we have
thumb,
problems more
everything is-
proximally or close to the center of the body, it can cause problems down the arm. Okay.
good.
So pretty much relax your shoulders first. Good.
What are
And
some
imagine
things
there's a
you're able to do
pencil
now?
between your shoulder blades,
brush
and you
my
just
hair.
squeeze that pencil gently until you feel stretch in
pull
your
up my
chest.
pants.
Okay.
Sounds like that's a good one.
Okay.
Yeah, so.
Then relax. Then once more, hold for like 5
I
seconds.
still can't do the
Excellent.
rubber band for the ponytail.
Okay.
Good.
I'm trying to do that.
And she can't
The
do her
main
pride.
goal is
Okay.
just to instead of like this, have an upright posture
Those
so you
require a
can
lot
function
of
better in your
fine
daily
motor
life.
skills.
And the overall principle is ears in line with your shoulders, shoulders in line with the hips.
Yes, sir.
Then relax. Good.
Oh,
Some
yes.
rubber bands
Uh,
are
So is that okay?
than others
Yes.
too, for the
Excellent.
hair,
Okay.
you know?
I
So
have thin ones.
It's the
and
pencil.
fat
I like the
ones.
Yeah.
Fat ones
Yeah.
I could, no.
like can you see your hand?
Yeah,
Hmm.
sometimes
So I feel like the main
I
issue
even
is
struggle,
that
and
it's
not,
hard
not
to
just
like
for me, but my
stem.
daughter, so
And
she has
do you
all
have
these
pain when you
hair
kind of
ties
like
now,
lay
and
flat?
theirs are smaller,
Is that
and I
okay?
find them really
Something's going on.
challenging.
Yeah.
Especially if your hair is thin,
And then
you know,
can you
thin,
Yeah.
fine
Put
hair.
the
Yeah.
soft
And then it's like,
cushion underneath.
and then you have to wrap it more times.
how does it feel to
I
keep
kind of,
that thing
you
up?
forget about that one, once I started doing
It's-
hers, now I'm
something's going on
very
there. It's not
understanding,
terrible.
you know,
Okay.
This.
it's a
Yeah,
difficult
bring the wrist
task.
up. Go ahead, bring the wrist up. You go up and down.
You gotta do this, and then you gotta do
Sorry, my
this.
hands are
It's
dry.
so-
You can relax.
No,
Yeah.
I'm
It's
sanitizing.
a good
This one,
exercise.
Because this, I want you to strengthen the wrist
Yes.
extensors, these ones, so hopefully you'll have less bending of the wrist when you try to make a fist.
There's something at home that we
Because,
can
like,
I
use.
mean, even if you don't have a stick, you can just do this with a
Like
fist.
what
We got
I'm
lots of
seeing, like the
stuff. We have lots of
presentation,
now.
Oh,
We-
highlighter.
Yeah,
I
highlighter.
thought
We have all kinds of- we have
or
all
dose
kinds
or
of stuff.
splint
Okay.
to kind of
We
keep
got stuff. She had her
that,
cane.
Yeah.
She got stuff.
a little
We
bit
got all
more,
kinds of stuff.
and
at
so
home.
to let it
My
heal,
mom can make it.
and then
I'm sure
over
you
time you
can.
get better.
I give her a
Like since
tool.
Dr.
I've got
Lefebvre
extensions
said,
that give her. I
Yeah.
give her
She
sweet
did
notes.
not recommend
Be
splitting
careful,
because
he might put
she
you
said
to
you don't
work
want something to
soon.
happen.
You
with
think
the
you're doing
damage
exercise, but
afterwards.
really you just
She
don't.
kind of
Yeah.
You're
scared me like,
fixing
'cause I was
something.
telling her
okay,
from the previous doctor to splint it.
okay,
She said, no, don't do that. That's not what we want to do. You want to be
Okay.
able to move it around.
yeah,
That's what she said. So
okay,
I
and
don't know
then
if
you see her at
How does
She's
this
gonna
weight
tell him
feel?
medicine.
Does this feel fine?
she, yeah,
I'm not saying
Okay.
it's very fit.
So once you
That's
get
surgery
stronger,
today.
what we do is we'll
Oh,
progress the
surgery
weight up a little bit
today.
more, you know, so right now it's a stick. So
She said
less
she's
than
in
like
surgery
1 pound.
Yeah, 1 pound weight.
She said no.
We got
We
the
could
little-
get
She said no, yeah, no
Yeah, the
wrapping.
little-
When I
the
saw
weight.
her,
No?
Let me grab the 1 pound weight and we'll see how that feels for you.
Yeah.
She said not to. I had the splint with me, and she said not to do that. She says, well, you don't want to. If you do that, then we need to have it mobile.
I got them on table right now, sitting on table. Yeah. But
So you brought in something?
I brought in the CVS stuff, you know,
Yeah.
split the
It's good
metal
too,
things,
cause
with
that's,
the rubber, the
it's a little bit
Velcros.
bigger
Mm-hmm.
to grip, sometimes the dumb
And
ones
she
are
said
skinny,
no to
so
those.
it's harder to
She
grasp
said, no,
around.
don't do that,
Right.
don't split them.
Did
So-
she
I may be
mention?
wrong.
Or those, they make those little water bottles.
Did she
too.
mention anything about like
Unless
using
it's
one of
really-
these
We have just like
plastic
that, we
ones?
have exactly like that.
Yeah, so if it's too hard, oh well,
Yeah.
we'll
So
figure it
what
out.
I would do
We'll test
is,
it.
That's too hard, you can't grasp it?
I think what she was
Not
talking
without
about when it was
fingers.
came to
Okay,
the
but do you feel like you
splint
can hold it
was
still if you-
just
Yes.
the ones that you brought in.
Yeah.
Yeah, you can go ahead and try to bring the wrist
I'm
up.
willing to bet
Nice.
Let's
that
just
She's
feel
okay
weight
with
wise.
the other.
the one that I can make
Heavy?
right
Okay.
now.
Yeah, sure.
Okay.
Any
So
pain
I'm
though,
gonna tell
or
you what
just
it
feel
is
like-
first.
Arts and
No,
crafts.
it's just heavy.
We'll make it.
Like I'm holding it with these two
Yeah,
fingers instead of all my fingers. You
Yeah.
can't like,
Quite get the.
quite get the.
Can you start the next person if I don't finish with this?
Oh, yeah.
So basically, it's like this. It's called thermoplastic, and it reacts to heat. And once it's heated, it can be molded. So basically, what I'll make is
I'll go
this
over and make her some
orthosis
sticks of
that
different
goes under
lengths and widths.
You know, that works, that
And
works.
then I'll do
and
that.
wraps around
'Cause I
these
got
two
all that
fingers,
stuff in the
so
garage,
it
I'll make
keeps
her
it
stuff
up.
like
Yeah,
that.
and I mean,
in that
the
position.
biggest thing is
But
really
you're
the
still able
circumference.
to
The wider it is, the
bend
easier it is for her
at
to
these
grab.
two
Right.
joints.
You
But I
know?
kinda wanted
But-
to squeeze.
Yeah,
it.
no, that's good.
You
So
won't
we
be able
don't
to
we don't
bend
want
right
too easy. If
here
it's
Got it.
to
just
kind
out
of
of range, that's the perfect
preserve
circumference because then she could,
this
you
tendon
know,
that
really
she
work to touch, and then once
most
it gets
likely
easier,
gonna
but that one's a little
work
hard.
at. And
Yeah.
yeah.
Amy suggested it to me.
Does that make sense?
Yes.
Okay, I'll start making that now.
Can I move the camera closer?
Yeah.
Go for it.
Yeah.
It's kinda skinny.
Is he wearing it at all times?
Yeah, we have pretty
Yes.
cans like that, the little
Yeah.
small fridges,
And
and
then
we
it's
have
left
tomato
right here.
Yeah.
Yeah.
Then when you see Dr. Lefebvre, you
Yeah.
can
Even buying tomato
just
paste
confirm
though.
that
Oh, we still have it also in the can.
what we're making.
Yeah.
So the biggest
How do you
thing
say her
when
last
you're-
name?
Because when you
My last name?
No,
make a
hers.
fist,
Hers,
you know, it
Lefebvre.
Lefebvre?
tends to
Yeah.
the
Is she
wrist
married to a
tends bend
Frenchman?
like this.
I have no
You're
idea.
actually making it harder for you to make a fist.
How old is she? 20?
I have no idea. She looks
You're
young.
trying
She
to
looks so
put
young.
these on
But-
like a maximum stretch, and you're fighting against more tension to make a
To extend.
fist. So
Yeah.
it's easier
Yeah.
to
So
have
Denise
it
and Trevor are
neutral,
gonna
even
sing now,
easier
right?
if it's
To keep-
back like this. But you want to kind of
To keep
the wrist
and be an
aligned.
extension, yeah.
That's the big thing. So then, can you feel the difference when I place the wrist like right here?
Denise is gonna sing
And then
for
if I
us
put it
now.
like
I'm
right
not
here,
gonna
do you
sing.
feel
My
like
singing is
the
horrible.
Who's your favorite singer?
My favorite singer, Sarah
Do you want
Bareilles.
it inches?
Oh.
My favorite art, yeah, one of my favorite artists.
From here to here.
What's your favorite song from her?
Oh, there's so many.
Really? Is she like what kind of like genre, like operatic
Yeah.
or?
No, indie. I like indie artists.
Oh, nice.
Indie pop artists. This is my favorite.
Fine
So
with the bottom.
0.8, I
I
guess?
have some instructions for you,
Oh,
mister.
yes.
Okay, so this is called an orthotic, which is
Okay.
what Trevor's going to make
Yes,
you.
ma'am. Yes.
So let us know if it causes any like redness
Okay.
or any problems like severe pain, numbness, tingling, or discomfort. You should
And then you make a fist.
feel fine wearing this. Or like if it doesn't fit well or like sliding around,
I
like
can call you guys up.
you can call us guys. We call us and then we can try to adjust it or like
Yeah.
fix it because the plastic does mold to you. So
So
it
you're
should
gonna
be a good
adjust it
fit.
from over the phone?
No, you'll come in
Oh,
and we
sorry.
would adjust it
Yeah.
if there were
She's out of
problems.
appointments. We need to make
Yes,
more
and
appointments.
then
So
so it
Do
will
that now?
basically lose its
Well,
shape
no,
if it's
no,
exposed to
no,
heat.
no,
So
I'm
like
not
don't
saying
leave it
she's
in your
not a
car.
secretary. I can go
Got it.
French to that. I'm just
Don't leave it
asking
near
you.
like the
Do we
stove.
make
Like
more
I don't
no,
appointments?
no.
Yes, but don't leave it in the
Yeah,
car.
we can.
Don't leave it in the
No,
closet
no.
because your car gets so hot.
It does.
It does.
What kind of car do you
When
drive?
you get